Welcome to the University of Michigan Dentistry podcast series, promoting oral health care worldwide.
An integral member of the dental health team is the dental hygienist. The dental hygienist has a number of responsibilities in practice delivering health care. We have with us two dental hygienists. Joan McGowan is a registered dental hygienist, assistant professor, and clinic coordinator at the University of Michigan School of Dentistry. And Carol Sowers, a registered dental hygienist, assistant professor, and coordinator of the Dental Prevention Education Clinic at the University of Michigan School of Dentistry. Professor McGowan, let's begin by taking a look at some of the duties and responsibilities of a dental hygienist in practice.
I think that these duties can be divided into several categories. The first one I'll mention to you is the oral prophylaxis, which is the actual cleaning of the teeth of the patient. Now, this is simple or complicated depending upon the nature of the patient and the condition of the mouth. If the patient has a fairly clean mouth, then the prophylaxis consists mostly of removing soft deposits from the teeth with instruments and a rotary rubber cup. If the patient has a more severe degree of problem, then the student will have to remove the hard deposits with scaling instruments and then use the rotary rubber cup. And if the hard deposits are located on the root of the teeth below the gums, then the individual would have to become involved in root planing procedures. This primarily takes care of the oral prophylaxis. Then other duties would include the taking and processing and mounting of x-ray films, which are used by the dentist for the diagnosis of the dental treatment that actually can't be seen in the mouth. Another duty would be the application of topical fluoride treatments. Now, fluoride is the only benefit, the only element known to man that will definitely reduce dental caries or cavities. So this is an important part of the treatment of the patient. Another duty would include patient education at the chair. Now, the dental hygienist is responsible for instructing the patient in care of his mouth. And certain patients require different instructions depending upon the degree of the dental disease present. These instructions could be along the line of toothbrushing techniques or flossing techniques, or if the patient had orthodontic wires, the patient must be instructed in use of auxiliary or other devices that would help keep the mouth clean. Another area would be in the realm of certain laboratory procedures. Now, the dental hygienist can take study model impressions, and she could, or he, I must make that distinction, she or he could pour up these models and trim them in the laboratory on laboratory machinery and equipment.
Professor Sowers, prevention and preventive dentistry is important in every dental office today. Could you comment on that, please?
Yes, this is certainly a very salient feature and should be one of the most important features of a dental office today. The dental hygienist functions in preventive dentistry both as a therapist and as an educator. First of all, in her role as a therapist, she functions both in terms of the conventional skills, which Ms. McGowan has mentioned. These conventional skills are being redefined and defined and redefined by the state legislatures today in the individual states. The preventive measures which the hygienist does provide are, first of all, primary preventive measures which have to do with the prevention of the onset or the initiation of disease, and secondary prevention, which is the prevention of further disease as it progresses. And the primary task which Ms. McGowan mentioned were the application of fluoride and sealant therapy. These are two primary measures of prevention. Secondary measures which she mentioned were, for example, prophylaxis. The hygienist functions both, as I mentioned, as a therapist and as an educator. Each of these are equally important to the patient in terms of services rendered. The hygienist's role as an educator is ever increasing in terms of importance to the dentist and in the private practice situation. Those dental educators who are willing to make a commitment to preventive education in the schools are those who are really progressive educators. This is not just an adjunctive service to the dental hygienist role. It is an integrative part of her role as a hygienist, and it is commensurate, as I mentioned before, in terms of its importance to the patient, to the therapy skills or the therapy services which are provided for him. The hygienist, as she functions as an educator, is not just an information dispenser. She functions with the patient as a psychologist who is interested and capable of motivating her patients to be responsible and to care for their own teeth and their supporting structures. She functions as a counselor, for example, in terms of taking care of their own dietary control. She works with her patients not as an authority figure, but really someone who is a consultant who is interested in the health of her patient. She needs to establish with her patients, find out where they are in terms of their understanding of their own oral health, find out what their beliefs and attitudes are, and work with them from there.
Professor McGowan, we talked about alternatives for the dentist. What about alternatives for the hygienist?
Well, the hygienist that graduates from the University of Michigan has a broad background. He or she has a background in the basic sciences, so they are prepared to do additional duties in an office. The hygienist that graduates from our program also has courses in psychology and sociology and educational sociology, so this individual is socially sensitive. And then, of course, they are versed in the clinical skills necessary in dental hygiene. So with these three bases for a background, the individual is prepared to work in private practice or in other areas. And I think some of these other areas that are coming to view are the local and state health departments. Hygienists who work in this area function in an administrative and advisory capacity and don't actually perform clinical functions in the mouth, but they are available to give help to local school districts and teachers and provide in-service programs and duties along those lines. Now, Mrs. Sowers has worked in that area, so perhaps she could expand on that a little more.
Yes, I think that the opportunities for a hygienist in public health are increasing greatly, and I think that this particular aspect of dental hygiene really offers an individual a lot of freedom and a lot of opportunity to create the kinds of programs that they may determine with their expertise to be most effective for the communities or the people with whom they are involved. The area of research is also another area, particularly at the University of Michigan. I know that there are a few hygienists here who are working in specific research programs, and again, this does offer opportunities to develop more specialized expertise in particular areas in which the research which they are involved in is directed.
And of course, we have to mention the opportunities available in dental hygiene education. Both Mrs. Sowers and myself are employed by the University of Michigan to instruct students in the art and science of dental hygiene. And because of the increase in dental hygiene programs across the country, especially at the community college level, there is a great demand for qualified dental hygiene teachers.
I might add that the role of the hygienist in the educational setting is really very satisfying. It offers opportunity in terms of organizational skills, planning, development, administration, creativity, and most of all, the interaction and relationship with the students.
What academic background would be required of a student interested in dental hygiene?
Well, if students are interested in applying for the certificate program, or as we call it, directly out of high school, they must have completed the college preparatory program at their local high school. This must include a course in chemistry and the Scholastic Aptitude Test, and we do look for a strong performance on the Scholastic Aptitude Test. Now, the other area a student can enter the degree program from is what we call a cross-campus transfer, or if they're interested in the straight degree program. Now, this individual would have already taken some courses at a college that would be transferable to our curriculum. The student is encouraged to maintain a high scholastic average, and we do look for a 3.0 average in college work, and we do look for a background in the basic sciences.
Thank you, Professor McGowan and Professor Sowers, for this most interesting discussion on the role of the dental hygienist in practice, in education, in research, and in public health.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.